Okay, I propose to begin. Good afternoon. First of all, I would like to apologize for my English, which is not very good as I do not practice enough. I will certainly make a lot of mistakes during this presentation. My name is Noëlle Biron. I'm an associate director at ANAP, the French Agency for Performance in Healthcare, and I'm in charge of a national program for hospital transformation. I will try to present it today. The program is named Projet Performance, and I will try to explain you about the principles and objectives of the program, the results, and the capitalization for the rollout. First of all, at the very beginning of this experience, in the year 2009, the Ministry of Budget was very worried about the financial situation of hospitals in France. And the Ministry of Budget wanted to launch 50 audits of hospitals. In the same time, the Ministry of Health decided that audits were not an efficient solution and decided to offer an alternative. The alternative was to support hospitals to drive a sustainable transformation with the aim to improve their performance. So the two approaches were very different, and the French presidents at the Élysée decided in September to choose the Ministry of Health proposal, which has been elaborated by the ANAP. In December, the first Projet Performance was launched. The objectives of the program are to drive hospital transformation with a threefold performance objective. First, in quality of care. Second, in quality of working condition for the professionals in the hospitals. And third, operational and financial efficiency. And the program supports the hospitals during all the length of the transformation, which is long. It can be 2 to 3 years, depending on the size of the hospitals. The objective is to involve the team, the hospital team, in a holistic transformation approach. The methodology is relatively classic. You have a first step of diagnostic and a second step of implementation. The first step, which is also characterized by a pilot initiative. I will talk about it later. In the first step, we make a holistic diagnostic of all the dimension of hospitals' performance. Then we have a prioritization of initiatives and the definition of a roadmap for all these initiatives. This work is made by, in fact, it's a joint work between hospital ground teams and consultants. We are working with consultants. At ANAP, we are a small team, about approximately 100 persons, and we do not have the ability to make the project ourselves. So we are working with consultants. And the team is looking for solutions improving the three dimensions of performance: quality of care, quality of condition, working condition, and efficiency. After this first step, there is a contract which is signed by hospital CEO, the regional health authority CEO, and the ANAP CEO. And then we can begin with the implementation of transformation. So we are going to implement the transformation in many fields. In fact, the action can target all performance levels of a hospital. You've got some examples. It can be in emergency room, operating room, bed management, human resources, and so on. The transformation is made by ground teams, including hospital and ANAP professionals, with the support of consultants. And we also are very interested in the capability building and the creation of a culture of performance in these hospitals. In fact, the success of a project performance requires the joint mobilization of many people, many profiles. At the first level, there is the hospital personnel. They are involved in transformation initiatives. They are operational project leads. They are managers, physicians, or any kind of other hospital personnel. Their role is to implement the transformation on the initiative, to disseminate the best practices, to ensure the mobilization of ground teams, and to identify, share, and contribute to the resolution of issues. At the second level, there are the project managers and the PMO. And this is represented by hospital project manager, the hospital general manager, the deputy general manager of the hospital, the regional health authority project manager, the ANAP project manager, and the ANAP national PMO. The role of this level is to ensure alignment of stakeholders. This is the most important thing to do at that time. To track and report, of course, and to coordinate issue resolution, to share the tools, best practices, to manage the project, and also to manage the communication on the project. And first, we've got the sponsors, of course, the Ministry of Health, the Department of Healthcare Offering, the Direction of Social Security, the General Direction for States Modernization, and the Department of Budget. They define the strategic orientations, they ensure allocation of resources, and they monitor the impact and provide the decision on specific issues. Here are the steps of project performance with an indicative length of each step. First, we've got to select the projects, and the length is variable because it's sometimes very difficult to identify both mature and willing hospitals and regions. Then we've got the first step, which consists in selecting the consultants for the first phase of diagnostic. This is the work made by ANAP. We've got the launch of the project, which means by preparing the kickoff with ANAP and hospital teams. Then the diagnostic itself, it's about 4 months, and it's a phase in which it's important to ensure that all hospital personnel is aligned on ambitious targets. Then we keep 2 weeks to validate the roadmap and sign the contract. And we've got another phase of 2 months to select the consultants for the second step of the project, which are not the same that in the first step. In the first step, we've got one consultant firm, and in the second step, several consultants, depending on the items in the roadmap. The transformation in itself is about 2 years. It can be more or less 2 years, depending on the size of the hospitals, but the average length is 2 years. And we keep, at the end, 2 weeks to evaluate and certificate the impact of the project. And we've got still the pilot initiative I will describe later. A national project has, of course, a national governance. Here you've got the governance body of this program. There is one first steering committee at national level, which provides strategic orientations, the decisions in case of deadlock, which ensures the impact is captured, and this steering committee is meeting every month. The members are representatives of the ministries sponsors of the program. Then we've got an ANAP steering committee, which validates the program, communicates the decisions, and the members of this committee are the ANAP team involved in project performance. Then we've got a project management office, a very classical thing, which provides a consolidated view on the program, defines the deadline, defines the principle, identifies the risks, and identifies the solutions also that requires a decision from the steering committee. And at the level of the hospital, of the region, there are steering committees regarding each project, which manages the project at the hospital level and provides transparency on project status, impact, and potential issues. At the level of a hospital, of a project, there is one strategic steering committee, which includes general managers as well as project leaders from the regional health authorities, hospital, and ANAP. They meet they meet twice a year, this committee, to have the strategic vision on the project. And the most important thing here is the operational steering committee, which meets every 4 to 6 weeks to monitor the progress and impact of the hospital transformation. At the level of the initiative, there is a joint multidisciplinary team with hospital professionals and consultants. The initiative lead must have relevant expertise and authority to lead the initiative and analyze the stakes. It defines the action, it tracks the progress, and contributes to issue resolution and escalate to the steering committee when it is necessary. The principles for the diagnostic is to have first a macro diagnostic and then a detailed one. First, the diagnostic adopts a holistic approach, which regards every dimension on the hospital management. It can be strategy, organization, human resources, information system, and so on. This first step of macro diagnostic is about 6 weeks to have a global vision. And then we refine it to have a detailed diagnostic on 6 to 8 priority initiatives, which will be used as a basis for the roadmap, respecting the rules to assess impact and including quick wins for the project. In a project of 2 years, it's important to also have quick wins. For us, it's very important to have a rigorous diagnostic because it's critical to ensure an immediate launch of transformation after the first phase. So the first phase ends with the elaboration of a roadmap, and a roadmap encompassing improvement on all the 3 dimensions of performance, the quality of care. Here we've got some illustrations, for example, the reduction of waiting time in the emergency room or to get an appointment, the development of day surgery, or the decrease in hospital-acquired infections. Regarding the working conditions, we work on improving the motivation. We work to decrease in absenteeism, to develop mobility opportunities, and also to achieve a decrease in overtime. And as for financial performance, the recurring annual financial gains must be at least 5 times greater than external costs of the program. The external cost of the program is essentially the cost of consultants. And of course, we also work for the improvement of operational efficiency, for example, the occupancy rates. The ambition for each initiative needs to be materialized in the roadmap by the key performance indicators that are quantified, measurable at the start of the project and at least quarterly, and for which KPI they must have intermediary and final targets defined. It's very important in a 2-year project not only to have a final target but to have intermediary targets. So now I will explain what is the pilot initiative. We wanted to have not only a diagnostic, which is an analysis of all the items in the hospital, but we wanted also to begin with the very beginning of the project, to begin with a real transformation, an operational transformation. This is the aim of the pilot initiative. The objectives are to rapidly capture first impacts, for example, before the end of the diagnostic, or at the latest 3 months after the launch. The objective is also to demonstrate impact and feasibility of the project and to ensure participant adhesion. The principle is to choose 1 or 2 pilot initiatives by project. They are selected within a list of subjects, emergency room, operating room, or bed management, for example, were the 3 possibilities in the first waves of projects. And the expected financial impact of this initiative is to have a positive return on invest through savings or additional revenues. For us, the pilot initiative is very important because it ensures that key success factors of transformation are in place and it can demonstrate the impact and the adhesion. For the roadmap, we also have rules to elaborate the objectives and the ambition regarding the operational impact and the financial impact. Regarding the operational impact on each initiative, we must have the definition of relevant key performance indicators that are measurable at least quarterly, as I said before, and also the definition of intermediary and final targets. And for the financial impact taken into account, regarding the operating costs, we took into account the operating cost savings, and the costs are accounted for on an annual recurring basis. For the investment, the recurring annualized investment savings are taken into account, and by exception, the avoided costs. We prefer the savings, and we do not like very much to count on avoided costs. For sales, only capital gains should be taken into account. For human resources, the annual impact of full-time equivalents cut or not replaced, netted of restructuring costs are taken into account, and regarding revenue increase, the annual recurring additional revenues are taken into account, but they cannot exceed 30% of total impact of the project. And at the total, the ambition must represent at least 2% of the hospital cost base and 20% of its deficit if there is a deficit in the hospital. I really would like to insist on that point. That's because hospital personnel is at the heart of the transformation. This is a key principle of the program. And it means that on each initiative, we have the involvement of 1 or 2 project leads identified based on the subject. There are administrative managers, medical department heads, nurse managers, and around them a team of 5 to 10 people, multidisciplinary team including administrative, medical and nurses profiles. And the team is responsible for defining the action plan to the transformation. So the action plan is really defined by the professional team. There is also a strong involvement of the senior management of the hospital in the project. It is necessary. Which means that many deputy general managers are appointed as project managers. That's important to be at the right level to manage the project. And they are involved also in the steering committees. That means that we've got several hundred professionals involved in the project. For each hospital, at least 100, 200 if it is a huge hospital. Here you've got an illustration of the monitoring that we make of the project. Of course, the impact is monitored closely. We've got a monthly reporting process, which is both qualitative and quantitative, that has been implemented to ensure a rigorous monitoring. It is made by a common tool used by every professional involved in the project. And in addition to this monthly reporting, we make a start picture and a finish picture. The start picture is made when the contract is signed, and the finish picture at the end of the contract. They are realized in order to assess the difference before, after. We want to see what is the real impact of the program. So we are looking in the start picture a lot of items in the environment, in the situation of the hospital, and we are going to look at the same items at the end of the program, so as to see if the program if the projet performance has an impact on these items. We've made 3 waves of hospitals in the project. The first wave of 10 hospitals, the wave 2 of 20 hospitals, and now we are working on the third wave, including 20 hospitals, which are just beginning at the moment. There is an innovation important in the third wave. It's because the regional health authority have now the lead in the program. I will explain that later. So what can we say today about the results of this program? We are now at a time where 30 hospitals are involved. Among them, 13 academic medical centers, 15 academic medical centers, 13 local public hospitals, and 2 semi-public hospitals. They represent an annual budget of over 12 billion euros and close to 35,000 beds, which is more than 10% of national capacity. The target financial impact for those hospitals is 330 million euros, corresponding to the 2% of their costs and 20% of their deficit. First impacts were captured through the pilot initiatives, essentially, during the diagnostic. You've got here 3 examples. You remember that for the first and second waves, the subject of pilot initiative were emergency room, operating room, or bed management. So you've got here 3 examples of results. In emergency room, the average waiting time has decreased. The time of first incision is later for the second example, and the number of empty beds in the bed management initiative, which has decreased also. So we've got significant impact on quality of care for patients. We've got impact obtained quickly. approximately 5 months, to be monitored over the long term, of course, to confirm if they are sustainable. And such pilot initiatives were launched in 20 hospitals on the 3 teams, emergency room, bed management, and operating room. The transformation is ongoing now, and they are in progress. The initiatives are in progress, aiming to improve the 3 dimensions of performance. Here you've got the list of the subjects in which the hospitals are working for that transformation. In the first, human resources is a topic very often taken, strategy, organization, etc., etc. And you see that for each subject, we've got to impact at least 2 of the 3 dimensions of the performance. Many operational impacts can also be observed by the monitoring that we made every month. Here you've got some example of these results. In an operating room, the KPI is the occupancy rate. You see that it is increasing. For the billing, the numbers of errors caught daily by the medical information director, which is significantly decreasing, more than expected. Cost reduction in support function, etc., etc. So we've got a lot of KPI that we are observing every month with our monitoring tool. Here is one example of the strong involvement of hospital personnel. I've chosen the example of one hospital in a particular situation because they had to move to a new hospital in the same time as the project performance. And we are moving so what? Because we noticed that all categories of personnel kept mobilized for the transformation despite the strong constraints of the move. And 2 months after the project launch, 3 weeks of which were dedicated to the move, the work plan was perfectly respected. In this hospital also, the government and the management of the project were very strong. And there is an outstanding involvement and alignment of the general manager, the project manager, the senior representative of the medical community, and the finance manager. The involvement of the regional authority is also important, and this is very important for us because they also signed the contract. We have one contact point for the whole project, and we have also one representative of each subject involved in the initiative based on his expertise. So there is a very strong teamwork between ANAP and the hospital in terms of monitoring and PMO. We have a trust-based relationship which allows us a very high level of reactivity. Regarding the financial results, here you've got the result of the program today, at the end of February. It's about 40% of the financial ambition that was already achieved. You've got the dark graph, which is the target, and the red graph, which is the realized. Now we see that for the moment, the result is a little bit more than expected. So now we're working on the 3rd wave of the project, and for the 3rd wave, there is a change of rules because the regional health authority role increases. Regarding the selection of consultants, it is still the ANAP business. The ANAP remains responsible for the request for proposal process, but we must include regional health authorities in the loop. For the project kickoff, we've got 2 kinds of kickoff, one with consultants, which is organized by ANAP, with the participation from regional health authority, that is very new. And the kickoff with the hospital is organized by the regional health authority, which is also very new, with the participation from ANAP. For the project management, the regional health authorities manage the projects. The ANAP is responsible for validating the consultant's deliverable with the input from the regional health authority. And the ANAP is also responsible to coach the regional health authorities members to help them build their capabilities and to help them be able to drive this kind of project without any intervention of ANAP. Because it is, in fact, the really maybe the most important objective of this program. The objective of the program is not to transform 30 or 50 hospitals. It is one objective, important, of course, but the main objective is to make that what we are doing with this hospital can be used by every others, and that every other hospitals in France can use this method, use these tools, and drive these projects by themselves. So this is my third point, the capitalization for the rollout. We began since the beginning of the project to think about the capitalization and the rollout. And the first thing that we started was to develop auto-diagnostic tools. So now we've got 18 thematic tools of self-diagnostic that have been developed and disseminated in the project performance community, for the moment only in this community. The principle of the tools, they are built to enable project participants to quickly initiate a fact-based discussion on their hospital performance. They offer common KPI and calculation methodologies, and they are elaborated to be used by hospitals by themselves, without any help, any external help, without any consultant, for example. They offer the choice between a synthetic diagnostic or a detailed one, and they come with a user's manual, a guide to interpret results, a completed version of the tool as an example. Precise that all the tools have been tested on several hospitals, which are not in the program, during the elaboration process. You've got the list here of all the topics about of these tools. The second thing to help disseminating the best practices was to create communities of professionals, the performance clubs. The principle was to create communities gathering professionals working on the same theme, for example, the bed management, purchasing, accounting, and so on. They are associated to national thinking on that theme, and they are responsible for promoting a performance culture within their hospital. The objective is to gather and disseminate experiences, in particular the best practices and the tools, enabling successful transformation, to enable professionals to meet and share by creating a network of professionals working on the same subject, on the same theme, and to highlight successes and acknowledge the capabilities acquired by professionals involved in the club. They also aim to develop autonomy and support capability building of professionals, for example, by ensuring understanding of the tools and the concepts. And last point, they aim to implement key success factors to ensure project targets are reached. For example, here is the first meeting of the bed management club. The objective of the meeting was to launch the club, to present the objective, and to make the participants know each other. It was also to deep dive on the bed management project of the hosting hospital, because the meeting was in a hospital, to present the project, to make a tour in the medical department and meet with the professionals involved in the transformation, to have a discussion with them and understand how they are doing, and to discuss as a group, as an expert group, on the best practices that could be applied elsewhere and the issue resolution. This first meeting was a success. We had more than 60 professionals. We had very positive feedback from participants who enjoyed being able to meet and share experiences. And now from these 60 people, we have a small group of professionals who are motivated to get involved in the leadership facilitation of the club. The following meetings are planned already, and they will deep dive on another project, and they will work on problem solving in breakouts or on specific issues. We also have a training program. The trainings are on 2 dimensions, and they have been tested and are now offered to the third wave participants. The 2 dimensions are operational performance and project management. Operational performance, the objective of this training is to understand the basic principles of operational excellence, to share best practices of operational performance improvement projects, and to encourage dissemination to other professionals in their hospital. It is mainly for the managers of the project. And project management is for every people involved in the project. The objectives are to share best practices on modernization projects, to develop, to reinforce the management skills. So what are our key priorities for the coming month on this program? Of course, we will pursue the program and we will reach the targets, or we hope so. So that means continue the performance initiatives and achieve the targets on all the 3 dimensions of the performance, to launch the transformation phases for the 3rd wave of the project, and to begin with the dissemination of best practices to all hospitals professionals. That means support capability building. That means organize experience sharing between hospital professionals. That means disseminate ANAP tools, not only for the project performance community, but also for all the hospital professionals in the country, and structure the rollout of the program that will take place after the end of the program. Finally, as a conclusion, I will take 3 points. The first is that I hope it is quite easy to understand that this transformation program is really a transformation program led by hospital professionals on the ground for hospital professionals. And this is a key factor of success for this kind of project. The second point is that the senior management's commitment is absolutely necessary to ensure the success. In hospitals where the senior management is not committed enough, the project is about to fail. And the last point is about the capability building ensured by trainings and the creation of communities of professionals is a point essential to ensure that this transformation is not only a transformation, a 2-year transformation, but is really a sustainable transformation. Thank you. I can try to answer your questions if they are not too difficult.
Thank you very much. I'm Saleh from Saudi Arabia. This is a really wonderful national healthcare improvement project. And I think the rest of the world should have access to the detailed reports and the methodology. Because to me, this resembles a role model of upgrading, healthcare at the wide scale. And my question is the protocol or the project as a whole available online in English? And if not, could it be, please? Thank you.
For the moment, not all the protocols are available online. Some are, for example, the tools that I mentioned in the presentation. They are not in English, I'm sorry, they are in French. I don't know if it could be possible for us to translate. I think it is. And maybe in a second step of the rollout, we will make it.
Thank you. That was lovely. For the number 1 objective, which was quality of care, how do the hospitals or you as a group choose the projects that you're going to concentrate on? What clinical initiatives, if you're choosing a clinical one, to choose cardiac over maternity over something else? How are those decisions made?
The projects are chosen by the hospitals, and a group of professionals in the hospitals is making the priorities. So we do not really we do not have many intervention in these choose because we really want that the projects are the professional projects. So we let them choose, we let them compose their professional group as they want, and we let them choose the topics they want to work on.
Thank you. That was really interesting. That's the first time I've seen a national program that has tried to encompass the whole range of quality activity. I wonder if you've had any insights from being able to link projects that have a different basis. For example, have you seen a reduction in infections, for example, and are you able to demonstrate that also contributes to the financial model? Because I can see that the changes in access, the improvements in operating efficiency, bed utilization and so on. They always contribute to financial performance. But it would be really interesting if you've been able to make a link with perhaps more clinical things that are sometimes more difficult to capture when you do it in a separate program. But you've all done it in the one program, so I think that should have tremendous advantages in showing us the synergy if you have that.
We hope that we will be able to make the link. For the moment, it's too early to say that, but we really want to make this demonstration, and this is why we insist on the fact that each initiative must have an impact on at least 2 of the 3 dimensions of the performance, because we want to make links, and we hope that we will be able to make it. But for the moment, it's a little bit early.
I'm interested in your point there. You said that it was critical for the transformation program that the hospital professionals led that. And yet I recall from an earlier slide that you had up on your time frames that you'd only allowed 16 weeks to engage senior health professionals in these hospitals. And I'd just really like to know how you did that in 16 weeks.
Well, they are indicative lengths, as I said, but we are convinced that it's important to go fast onto the discussion, the transformation. Because when you are in a big hospital, as the one we are working with, you can easily spend months and months doing a diagnostic, discussing on the items, discussing on the KPI, etc., etc. So, of course, there's a lot of pressure. On hospitals to enter the program, and they know that. They know that they must be able to go fast in the diagnostic and in the transformation. It is a rule that we are keeping, and if the hospital is not able to align all the people in the project during the 6 weeks, it may be 8, it may be 10 sometimes, we cannot do the program. It's really important for us to go very fast in the analysis, in the discussion, and then even faster in the transformation.
Michel Katz from the Netherlands. I was wondering, I saw some operational goals, for example, for the ORUs. How are these goals set? Are they nationwide or hospital specific?
Hospital specific. Of course, we've got some standards, national standards, which are used to determine the objective of each hospital, but they are specific hospital by hospital.
I'm Xavier de Béthune from Belgium. I was just wondering, how do you collaborate with the High Authority of Health in France? Because your work looks very similar to theirs, and how do you do that?
We've got a very close collaboration with the Agence, but on this program, not specifically, just because we are working with them at the beginning of the program to see what were the conditions of certification, for example, of the hospital we are going to work with. And then we have regular meetings with them to report on what we are doing and what results we are having on the program.
How coherent is your self-evaluation tool with the certification requirements of Agence?
We took into account the certification results, but our tool is much more detailed, in fact, on dimensions like management, finance, human resources, which are not very present on the certification program.
What kind of contracts are you actually making with those hospitals? Could you tell us something more about that?
So the contract is between the hospital, ANAP, and the regional health authority, and the contract is made to ensure that the objectives are shared between the 3 actors in the program. And in the contract, we've got the plan of action. So the contract is very detailed on what are the plan of actions, what are the objectives, the financial return expected, and all the KPI are also mentioned in the contract. So the contract is really something important to ensure the engagement, the alignment of all the people who sign the contract.
But is there also a financial grant given when they accomplish their goals, or
No.
a fine when they don't?
No, the financial point is that for the first step of the program, the diagnostic and the building of the roadmap, the ANAP is financing the consultants. In the second phase, the ANAP is financing one part of the consultants and the hospital the second parts. Okay. So this is a kind of incentive, the fact that ANAP will pay the intervention of consultants.
They will save money. They will save money.
Yeah, we think so.
Hi, my name is Kerry Charles and I'm from Nottingham, England. We've got a hospital-wide project that's got about 200 projects individually going on. So it's been really interesting for me to see how that sort of pulls up to a national level, working across many different hospitals. And the question I have is around sort of longer-term sustainability. I know that you seem to have a very strong governance meeting structure, and you're working directly with staff to make those sort of cultural changes. But is there any intention, a year, 2 years down the line, to keep monitoring performance against the standards that you have, that people have achieved, to make sure that it sticks and that you haven't invested something that sort of a year, 2 years down the line, people go back to old practices, or that improvement isn't sort of continuous?
Yes, you're right. The monitoring and the length of the monitoring is a key point, and the aim of this program is that the monitoring continue by the regional health authorities. They are in charge to go on to disseminate the program and the best practices, and to monitor the ones with them which we have worked with in the beginning of the program.
Thank you. Charles Swainston, Scotland. You must have some hospitals now in the first wave who are coming to the end of the 2 years.
That's right.
And they must have nearly completed all that they agreed in the contract. So what is for them next? Do you think they're self-sustaining and they can now develop their own targets, their own improvements, or do you think you will need to continue to support that, perhaps in different ways for a while?
That's an interesting question. That's right. Actually, some of the first hospitals are practically at the end of the program, and the situations are very, very different. There are some of them very good in the program, and I think we don't have to continue to support them. They will be able to disseminate in their own hospitals, in other topics, the methodology and the tools we have used with them during these 2 years. And some of others hospitals are a little bit weak in the program, and we're having a reflection, to think about the ways to go on in kind of a support, of course, a very light support regarding what we are doing today, maybe with the tools, maybe with some guides, some good practices, or maybe with the communities, but we've got the feeling that some hospitals cannot be let in their situation now, even if they have made a lot of work. Okay, there's no more question. Thank you very much.